Good morning. My name is Greg Olson, and I'm the Acting Director of the New York State Office for the Aging. I'm very pleased to welcome you all to the No Wrong Door Regional Trainings. These trainings are an important component of the required structural changes that are underway as a result of the Balance Incentive Program. I would like to personally thank you and acknowledge the important work that you're all doing to advance the deliverables of this significant initiative. Accomplishing the changes that we are undertaking together requires patience and perseverance, and we recognize all of your efforts to stay the course during this very busy time. You have continued to remain steadfast in the face of an evolving service delivery system, with your end goal to be providing individuals of all ages and their families with person-centered programs and services that support and empower them. We thank you for all of your efforts and the work that you have accomplished so far. Our goal today really is to leave feeling confident and empowered to continue to push forward to advance the important systems change. Thank you again so much for being here, and we look forward to our continued work together.
I want to welcome you today. Thank you for being here. And I want to echo Greg's comments on the video. He couldn't be here today, but it was very important to him that he express both his appreciation for what you do and also in terms of how important the work that you're doing is and what is transpiring, the transformation that's transpiring. We also, I want to say at the get-go, we know you're overwhelmed. We know that there's a lot of change happening in a lot of different ways, both in terms of IT systems, in terms of expectations, in terms of the way you're doing things, and it's overwhelming. And we know, we know that we're not getting the responses as fast as you would like, but know that we're very hard at work to do that. This was a major systems change in terms of the system, along with all the other changes that are happening relative to New York Connects, and working with new partners and learning the systems in a deeper level. So we appreciate everything that you're doing. So I have to start out by saying the purpose of today's trainings is not about informed consent mechanics. There won't be anything about that at this training. That's not the purpose. That's a whole different set of work that's going on. We will be touching on consent, though. Phil will be talking about it at one point in his presentation and discussion with you. But I want to tell you what the purpose of this is. The purpose of it is to enhance and inform your skills base in providing information assistance and options counseling, now being called person-centered counseling. And I'll talk about that more in a second, as well as emphasizing new partnerships or expanding existing partnerships, as the case may be, and dealing with new populations in a very hands-on way. Because even though you're not expected to be the experts in terms of the new expanded populations you're working with, the expectation is that you do understand how to get them connected to what they need and to be able to work across multiple systems simultaneously, because we know that people have a tendency to have co-occurring needs, for lack of a better way to say it. People are not, as you all know, and that's why No Wrong Door, the hub, is with New York Connects and largely with the Offices for Aging with an expanded partnership, is because you understand the need to help people in a holistic fashion. Not that other systems don't, but some of their funding streams kind of drive things a certain way, whereas you're dealing with a variety of funding streams and are very community-centric. So you really know what those services on the grounds are, and know about and are learning more about those other systems in order to get people connected to those systems for resources or information assistance that they need. So you really are the specialists in delivering person-centered information assistance, and the emphasis is really on person-centered. Both the Centers for Medicare and Medicaid and the Administration on Community Living have put a great deal of emphasis on no wrong door relative to being person-centered. So, and being truly person-centered, which I'll get into in a minute. And in that role, you're helping individuals identify what they're seeking, what it is that they want, when they may not even realize yet what they want, because they might be in a crisis and they don't know what's out there and they're not really sure which way to go. And sometimes that initial reaction may be to seek a more residential or institutional setting because they're not aware of all the community-based services. And one of the goals is help them be aware of what's in the community so they can stay where most people really want to be, which is in their community and at home, however home looks like. And how to access those services to meet their needs and wants. And so something to be very cognizant of that's going to be brought out in these trainings, though, through this process of person-centered, is we have our own preferences and ideals. So while we're bringing our personal and professional strengths, which are many, sometimes we're not so aware of what our own preferences and ideals are that we might hold and not be conscious of it. So it's important to become aware of what any of those preconceptions are, because they might not be aligning with what the individual wants. Because in this new world, which is really hard, when you're a helping professional and what you want to do is you want to help the person, and due to experience, you can see what the road may look like, but it may not be the road that that person wants. And so helping the person identify risks and then helping, I don't know if it's helping, I don't know if helping is the right word, providing decision support so they can assess what level of risk they're willing to take, and then allow them to make that decision. Now, we're not talking about a situation where there's immediate potential for harm to health and safety. We're not talking about APS cases where you would need to call them, or where you're talking about law enforcement that needs to be called immediately, or other concerns that really present an immediate danger for the person. But in the regular course of assisting people, that really allowing them to understand and allow them to express their values and what they want, and helping them get connected to those things is really what the expectation is around information and assistance with No Wrong Door and for person-centered counseling. So we're really focusing on adopting a true strength-based perspective that focuses on decision support and identifying the risks that may exist relative to certain options, because that is what marks a true person-centered process. And again, it can be very challenging, because when you're identifying risks for a person and you're not really wanting them to take on that, it's up to that person. So what has to happen is you need to leave that door wide open, so that if things don't work out, the person feels comfortable to come back again. Because things don't always work out the way you think, and sometimes you might have a perfect plan, what seems like a perfect plan, and something goes awry, or the situation changes, or all kinds of things happen, which I know all of you deal with. But it's really about having that person feel comfortable that they know they can come back to the hub if something New York connects, if something doesn't quite work out, and get some assistance in terms of reassessing options. The other piece of that, which also makes it challenging, is we all know that not all the services are there that we would like to be there necessarily to help that individual or what the individual wants. And so sometimes creativity really comes into play, which is what you're all very good at, in terms of identifying what other possible community resources there might be that can help address whatever the identified needs are. So that might be a temporary situation while waiting to receive services. It might be that the service just doesn't exist. It might be that there's a long wait list. So it's about finding other things that can help that individual during that time, and keeping in follow-up with them in those kinds of situations, if that's appropriate. Again, it depends on what that situation is, whether or not they went on to get a case manager or not, so on and so forth. It's not case management, but it's just being there to be able to know that that door is open. Let's see. I think I really talked about that, so no need. Another thing that I just want to mention is that we really recognize that there are additional training needs, and we are working on a variety of Q&As in different formats. I'll mention consent for a second because I know it's on everyone's mind. So we do have a learning collaborative. It will restart in January. We want to be very efficient and effective with everybody's time, and so we actually, need a little time ourselves at NYSOFA to do a little catch-up and to be able to restart. In the meantime, we do have a small work group that is working on looking at the various scripts and the forms both in the system and the written correspondence, a small group of directors. And our process is with that small group is that we look at those things, revise, and the first thing that we did was through SurveyMonkey, where we sent out new language around attestation. We identified that as the top level because we're hearing so many concerns about staff not being comfortable with the language and interpreting it in a way that it wasn't meant. So that was sent down. We're wrapping that one up, and we'll be proceeding on to other things. So whatever language we have will always come back again to the full group for your input also. So this is a process. We hope that you know that our goal is to work together and to get your input, and that you'll continue to work along with us. There is a curriculum that's been developed at the national level for person-centered counseling that we're exploring as a follow-up to this training, and you'll be hearing more about that in 2017. For some of you, this training is going to be more of a refresher. For others, it's going to be new, and it's going to be everything in between, depending where you are. Our last in-person training on information assistance took place a very long time ago, and options counseling was about 5 years ago. So this truly is either a refresher or new, depending on where you are. So we have a full agenda today. We're going to begin with a skills-based workshop on the delivery of INA and options counseling, person-centered counseling, to be provided by Philip McCallion, who I'll introduce in a minute. Will take us through lunch. It'll be followed by an update on the No Wrong Door screen and also the pilots, which have been launched. They've gone live from the Department of Health. And in the afternoon, we'll have a session that will be presented by folks from the Office of Mental Health. And then we will be having an interactive closing session that I think will be pretty lively and some fun about cross-systems, about working cross-systems and community resources. So before I introduce Phil, I just want to announce that many of you probably already know that we had an RFA, request for assistance, out to seek 6 contractors that would work with each New York Connects program. They've been selected on a regional level, and I just want to share with you who the awardees, grantees are. So I'm going to announce 3 regions because we have 3 regions represented here today. Region 1 of Western New York is the Western New York Independent Living, Inc. And That covers Allegheny, Cattaraugus, Chautauqua, Chemung, Erie, Genesee, Livingston, Monroe, Niagara, Ontario, Orleans, Schuyler, Seneca, Seneca Nation, Steuben, Wayne, Wyoming, and Yates. For Region 2, Central New York, it's the Resource Center for Independent Living, Inc. of Utica, and that's Cayuga, Cortland, Jefferson, Lewis, Madison, Oneida, Onondaga, Oswego, St. Lawrence, Broome, Shenango, Tioga, Tompkins. For Region 3, the Northeast, it's the Independent Living Center of the Hudson Valley, and that's Albany, Clinton, Columbia, Delaware, Essex, Franklin, Fulton, Greene, Herkimer, Montgomery, Otsego, Rensselaer, Saratoga, Schenectady, Schoharie, St. Regis, Mohawk, Warren, Hamilton, and Washington. I don't think I missed anyone who's in the room. If you did, you can either just raise your hand and I'll let you know who the grantee is, or you can see me later. So with that, I'm going to introduce Dr. Phil McCallion. Phil McCallion is a distinguished professor at the School of Social Welfare and co-director of the Center for Excellence in Aging and Community Wellness and faculty executive for QTAC New York at the University at Albany. He is co-principal investigator of the Intellectual Disability Supplement to the Irish Longitudinal Study on Aging, a visiting professor at Trinity College, Dublin, a John A. Hartford Foundation Social Work Faculty Scholar and Mentor, and a member of the steering committee of the National Task Group on Intellectual Disabilities and Dementia. And he's been a partner on the New York Connects journey in a variety of capacities over the years. So it's my pleasure to welcome Phil.
So I was thinking, I'm in Binghamton. Like, we've been doing this tour of the entire state. We're now, I think, this is the 7th or 8th? Maybe
This is 7. We have 2 more after this.
Right. And so then I thought, here I am in Binghamton, and I had flashbacks about consumer-directed, participant-directed services, care transitions, Alzheimer's projects, and I see a lot of faces that look familiar. But to Lori's point, how many people were here for the original trainings that we did for New York Connects? Okay. Yeah, we have a couple. Okay, it's not just you and I, Lori. I can just... So it is important to think about that as we then sort of think about what comes next and what has come next. And I think back to those original trainings around New York Connects, and how much of that was about sort of really thinking about building capacity to be able to have people have someone to call and to easily reach someone when they called. To talk about sort of a telephone number that was well known in a particular county, and to have people to answer that phone and to be able to answer some basic questions. And that's how all of this started. But it started building upon the strengths that already existed within the aging network. And it was primarily focused upon people who were older adults. And since that time, we've now expanded. We're now looking at certainly a much greater involvement with people with disabilities. We're also looking at a much broader range of services that people potentially can access through New York Connects, looking particularly at things like mental health, looking at substance abuse issues, and also greater collaboration with agencies serving people with intellectual disabilities. So for our purposes today, we have a number of objectives. We are certainly looking to understand the definitions, the terms, and the concepts of options counseling and person-centered counseling, and Lori talked about how that has evolved. We want to give you some opportunity to experience the usefulness of the skills and the tools associated with options counseling and person-centered counseling. But all of this really is focused upon supporting quality of life and supporting maintenance in the community of older adults, of people with disabilities, of people with Alzheimer's disease and other dementias, and their caregivers, and also helping people to better address behavioral health and substance use disorder concerns as well. Oh, sorry. Okay. So I'm going to ask you to do a couple of things. You all came here with people that you already know, or perhaps not with people that you already know. We're going to be doing some group activities during the course of this. That's where I wanted to be. Thanks. And so that requires some interaction. And so I want to start this off with just a simple activity. I'm going to ask you all to introduce yourself to another person, preferably somebody that you didn't come here with, so feel free to get up and move around. But I'm going to set a couple of rules. I'm going to ask you to do two things: that when you introduce yourself, that you not share what you do professionally. You don't tell people what your job is, your position, your degrees, or your title. And when the person introduces themselves to you, you don't get to ask any questions to get more information. This is simply about what the person is willing to share. And then I want you to switch up and have the other person introduce themselves to you, following the same rules. So is everybody clear about what they have to do? Any questions?
Will you tell us when it's time to switch?
I will let you know when it's time to switch. Okay, so then let's introduce ourselves to someone who we don't know particularly well. Okay, so if we could have a couple of volunteers, and we have a couple of people with mics going around so that everything will be heard. What was it like to introduce yourself by talking about personal things instead of professional things?
It was fun.
It was fun. Okay, other thoughts?
It's actually a little difficult because it's much easier to talk about who you are and what your job is and what your role is and what your background is professionally. When you start to actually talk personally, it's actually a little bit more difficult, and because how we define ourselves.
Right. Okay, so it's both fun, but there's also some difficulty because we're just not used to doing it, because our professional roles are often part of how we define ourselves. So how did you decide what you were going to share and how much you were going to share?
I decided by, you gave me some very specific things that I could not talk about.
Right.
So that made that pretty easy, and we had a time frame.
Okay.
So, yeah.
All right.
That was how I decided.
Yep. Yes.
I was going to say that it's nice just to kind of get to know a little about someone, where they live, where they're from. So, we were able to engage on that level. Again, it was a short period of time. So, but I think that's part of what we do is getting to know the person, who they are, and you kind of get a little bit about their personality along with it.
Okay. All right.
I'd say all of the above, but I also felt like how much I was willing to reveal and what I was interested in revealing had a lot to do with how interested she seemed in what I was saying.
Okay.
And how engaged she
All right.
appeared to be.
Yes.
It helped me decide what to share because I was second, and I shared similar things from what my partner shared.
Okay. All right. So let me ask you a different question. What if a professional person wanted a lot of personal information from you? How would you approach that? Would it be as comfortable as what you've all just described? What questions would you ask?
You got somebody here.
No, ask that again.
So if a professional person wanted a lot of personal information about you, how would you approach that?
Personally, really, if I was on the opposite side of the desk, I'm not willing to give that information up.
Okay.
Easily.
All right. Any other thoughts? Nope. I got a couple.
I think it's all in the presentation. I think that if somebody is truly interested in inviting and builds a relationship that's trusting, I'd be much more willing to share because of the comfort level. So I think it depends on the presentation from the person that's speaking to me.
Okay. Yep.
I was pretty much going to say what she said, but I'll add that the other person on the other side, knowing that they're coming to you and wanting the help, they're more willing to share that information with you as long as you present yourself, like she said, in a manner that is comfortable for them.
Okay. All right. Oh, one more behind you there, Lori.
I think I would want to know the reason why. I would want it to be fully explained to me why the information is needed before being willing to share it.
Okay. All right. So our clicker's not working, so I'm going to ask Teresa to advance slides for me. If you could just, and again, and again. So why does all of this matter for our work here today? What do people think? Yes, at the very back there. Lori.
Well, it has to do with when you're meeting a client for the first time, especially if you're going to their home, which I do a lot of. And, you know, you want to make sure that person's comfortable when you're going to ask a lot of personal questions.
Yep. So we are in the business of asking a lot of personal questions. As in the example here, certainly when you're going into the home to do an assessment, but often when people are calling you on the phone, we're also in the business of asking a lot of personal questions. I like the response, and this has come up a number of times where people have said to me, well, it was easier because I was second. Because that sort of gave you some parameters. But how many times for the people that we're talking with, either on the phone or when we're doing assessment visits, do they get to be the second person who shares personal information? It's always easier when you're second. So I think we have to think about, as we sort of set up, whether it's the phone call or a personal visit, how do we build that trust, that comfortableness, when really we're there asking questions? How often are we clear that we have a responsibility, as someone said, to actually explain why we need the information that we need? Do you have your hand? No, sorry. I thought someone had their hand up. The next one. So we have, over the last 10 years, together really developed a series of skills around information and assistance. But what's happening as this develops is that we're moving more and more into a standardized and comprehensive screening process. But we're also moving towards, as we ask people to tell us more, as we think about how we maintain people in the community, as we think about what's going to happen in the future, as well as the immediate need that someone has expressed when they call us, that we're also moving towards a more personalized counseling approach to help people make informed conditions and to access available long-term services and support options. And the range of services, as I said, have increased. Also, as I talked about earlier, this is about older adults, it's about people with disabilities, it's about caregivers. We started out very much focused upon doing better phone work, but we're also doing more in terms of face-to-face meetings in the office, in the community, in the home. And we're also doing much more today by email. On the one hand, we clearly have a group of people among whom there will be some who still don't use email or don't have a lot of access to the internet and things like that. But we're seeing more and more people, and likely we'll see more and more people as we go forward in the future. The 1 billionth download from the Apple Store was by who? A 67-year-old man. And he downloaded what music file? Johnny Cash. Just a little piece of trivia. So that we can't simply assume that older adults are not utilizing the internet or are not utilizing email. And as we move into serving people with disabilities, as we move into expanding our roles with caregivers, We need to be thinking about those resources as well. Excuse me. So that's why, for example, there's been such an emphasis on the building of the online resource directory of providers of long-term services and supports. So, but we are building much more than that. And yes, this is your eye test. Can you read the diagram? So what I did was I printed the diagram off, and it's on the back of the handout. But it's not so much that I want to focus in upon the individual specifics, because much of this you're not going to interact with. But it's more about the awareness that what's happening for No Wrong Door, what's happening for New York Connects, is part of a much larger effort within the state of New York to really connect things up electronically so that there is less need to ask people for the same information over and over again. So as No Wrong Door, you're often that first point of contact. You're collecting information, you're putting it into electronic systems. Some of that information, at least, will be then accessible to other people, provided, of course, consents have been received and sign-offs have been received as appropriate. But then, so that, again, that information doesn't need to be asked more than once. And we begin to build an electronic relationship with the person as well as the in-person relationship with the person. The other thing that this permits, if you look at here, the little yellow boxes at the bottom both say reporting. Right now, you know, or when we started out in this, and sort of the people from NYSOFA are called and said, we want to know X. Somebody had to go through paper files to figure out sort of what the numbers were on those things. We're now moving to the point that that aggregate information can now be collected through these systems. But I want to be clear, it's about the aggregate information. Individual personal information, someone at the state level can't just go in and pull someone's record up. That's not the way the system is set up. But it does become possible that people can look at the reporting in terms of aggregate data to understand what the trends are of what's happening. And this will increasingly influence the way in which resources are assigned, because we're being driven by the needs and the activities related to No Wrong Door. So I've mentioned No Wrong Door a couple of times. If you could advance, yep. So people making inquiries about community long-term services supports, the initial thing that they will do will be to go through the No Wrong Door screen. It collects preliminary financial and functional data. It points to potential needs and program eligibility. But we have to be careful that that's not all that it becomes, and that sort of we immediately then move into providing services based upon this initial information that we've gathered. And that's where options counseling and person-centered counseling increasingly come into play. The screen may be conducted over the phone or in person by trained designated New York Connects or No Wrong Door staff. And both the collection of the data and the usage of the data is then driven by user roles and user authorization to access the system. And it's also driven by whether or not people have given consent, both for their information to be entered and for their information to be utilized. So one of the ways it potentially, and I only say potentially, gets utilized is that it can be linked up with what's called the Uniform Assessment System, which is a secure web-based software application platform. This is a system that contains electronic adult and pediatric assessment instruments. So there is both so again, that sort of there's a more systematic way in which it's being approached to determine whether or not people are eligible and whether or not they are in need of specific Medicaid home and community-based long-term care services. So some AAAs may be conducting selected assessments within this uniform assessment system. All of these things continue to develop. But access to this information, again, is based upon the user's defined role, rights, and authorization. And I'm going to look at Lori just to make sure. Yeah, okay. So as we move forward with this, there's a series of challenges. Clearly, we're making decisions about resources, we're making decisions about training. We don't yet know what the demand will be, what the uptake will be among older adults and people with disabilities and caregivers. We're thinking about what's the appropriate infrastructure to manage this demand. So some decisions have been made about additional resources coming out to the counties to be able to support these new activities. We're also encouraging, and being encouraged to think about how we customize the technology to enable online interactions. But you know, there's a real danger that this becomes a very depersonalized process. It's all about the screens, it's all about the computer mediation of all of this. We still need to think about sort of how we maintain personalization and how do we balance being person-centered with meeting requirements. And so again, as you think about that activity of introducing ourselves, you know, how do we maintain this being a conversation where the person feels really comfortable and respected and that you're interested in them, and we take care of all the things we need to enter. Recognizing that if I don't feel valued, if I don't feel you're interested in me as a person, I'm probably not going to tell you everything that you need to know. So that sort of even to meet the screening needs, we still need that relationship. So for each of you, it's about thinking about how you're going to set up the equipment. If we're going to now be utilizing 3 or 4 screens and we're going to be entering things as we talk with people, is it going to be this, where we're sort of trying to balance everything and not getting everything done? Or are we going to set ourselves up for greater success? Are we going to use double screens? Are we going to split our screens so we can see more than one form at once? Are we still using a phone? Are we using a headset? You know, all of these things, they're sort of small, practical things. Is it possible for me to conduct a conversation with people and have some privacy? Is it possible for me to conduct a conversation with people and there not be background noise and things that interrupt? I think a lot about the quality of phone instruments that people have access to, not just within your own offices, but also the people that you're talking with. Inga, who lives in the house right behind me, has known my son since he was 3 years old. And so, you know, when she needs something, she'll see him coming up the street and she'll call him in to sort of take care of something for her. And he's very good about it, and he goes in. The other day he was in there, and first of all, I didn't understand how this happened. He didn't have his smartphone. I don't know how that can be surgically removed from him myself, but he didn't have a smartphone. And so he needed to call me for something, and he went to use her phone, and he stood there, and he looked at this rotary dial phone that has been there for so long that he was explained to me afterwards, the numbers were worn off, so he didn't actually even know what the numbers were supposed to be, and he was like, okay, how do I call? So if someone's using a phone instrument like that, well then it's clearly not high definition audio either. It's a pretty sort of basic phone. And so some of the people that we're working with have very basic phones. And so again, sort of how do we ensure that we're able to have good conversations with them? The headsets work really well for us, but that's not the experience that many of the people that we're working with have. So let's watch a short video.
Hello, this is Jacqueline at New York Connects.
Do you realize I've been on hold for almost 10 minutes?
Well, with all due respect, I really don't think it was 10 minutes. We do get a lot of calls, but no one waits more than a few minutes. But tell me why you're calling.
It was 10 minutes, but I guess that's the way it is. I want to understand how to get a nursing home bed on Medicaid without having to sell my home and give away my children's inheritance.
Well, I really can't help you with avoiding obligations to Medicaid, but maybe you can tell me about why you might be interested in a nursing home bed.
Well, my house is really big. It's becoming too much for me to keep it up, and the neighbors, well, They're complaining about the way I was caring for my cats, and I'm afraid they're going to call someone and complain. And you know, you see this happen to older people all the time on TV. I don't want to be one of those people they talk about, that they lost it and they can't take care of themselves. But then people can't make up their mind if they feel sorry for you or think you are a cruel person who doesn't take care of poor animals like cats.
Well, it sounds like there's a lot going on, and some of it is really worrying you. Maybe we could talk about some of the details to see if we can find ways to help you.
That would be good, because I'm actually really worried.
So let me gather some information and enter it into our system. So if we decide on some services, I don't have to ask you the same information twice to complete any applications.
Well, wait. What's going to happen to the information? Who's going to see it?
Right now, just me. If the services you decide on that you're interested in require any information to be shared, I will ask for your permission before I do so.
I may not want to provide all the information that you might ask for.
We can deal with that when it happens. Let me just try to better understand what is going on.
I don't think I want to do this. I'm hanging up. Why weren't you there when I called?
I must have been on another call. Did someone else pick up?
Yes, she said her name was Kate. But I said I wanted to talk to you. I wanted to talk to Jacqueline. I was on hold again for 10 minutes.
I'm sorry I was on another call. Did Kate not offer to help you?
I told her I wanted to talk to Jacqueline.
Well, now you are. How can I help you?
No one sees my information without my permission?
I promise. Once we are ready, I will explain the consent process. So why don't we start over? Will you tell me your name and something about you and your situation?
Okay, my name is Karen. I'm 76 years old, and I've lived in this house for 40 years. My husband and I bought it under the GI Bill. He served in Korea. He didn't really talk about it much, but I think he saw some things that just really bothered him. He'd wake up sometimes at night all of a sudden, but he wouldn't talk about it. But that's when he was alive. He died about 8 years ago. Are you married?
Well, that's all really interesting, but tell me about yourself. For example, your age, your address, who lives with you, and do you have any children?
I already told you my age. I'm 76. Aren't you listening to me?
Sorry, I didn't get that. So it's Karen. What's your last name?
Karen Jones. And I live at 33 Maple Lane. It's a really nice house with a big yard, although it's just too much for me. My children loved it when they were growing up. Oh, that's right. You asked me about children. Jim Jr., Kathy, and Paul. The 2 boys moved away, and Kathy, well, we had words a few years ago, and she still visits, but she's very busy. What's that clicking noise?
Oh, don't worry about that. I'm just putting information into the computer. Just keep talking.
Well, what do you want to know?
Well, let me just open up another screen here. If we're going to talk about nursing homes, I need to complete some scales to assess what we call functional abilities.
And this will help me protect my money?
Let's just gather some information. Maybe we can come up with other services besides nursing homes.
You know, I talked with the nurse in social services 2 weeks ago, and she already completed some scales, just like you're talking about. And she said I was eligible for a nursing home. You know, you should just talk to her. Her name was Jessica Brown. Do you know Jessica Brown?
Yes, I do know Jessica, but let's just collect more information.
You know, I don't think so. You need to talk to Jessica, and you need to do it now. This is all just a runaround.
Okay, why don't I call Jessica, and then I'll call you back. Do you want to give me your number, and I will call you back after I speak to Jessica?
345-6789. Call me in 15 minutes.
Hi, Mrs. Jones. This is Jacqueline. Or can I call you Karen?
Mrs. Jones. I said 15 minutes. You call this 15 minutes?
Mrs. Jones, you hung up before I could explain that I wasn't sure how long it would take me to get in contact with Jessica. I did call back 20, 25 minutes later, but there was no answer, so I tried again. Is this a good time to talk?
I said 15 minutes. Do you have the information on nursing homes and how to avoid losing my money to Medicaid? Jessica said it was possible.
I realize that you're feeling stressed by your situation, that sometimes this means we don't always hear things completely. Jessica explained that when she talked with you, she was explaining the assessments that are completed when someone is considering a nursing home, but she said they did not get completed.
That's not true. She told me what was required, and I told her I had all those things, so I already was assessed.
I know this is hard, but let me open up my screen and let's actually complete the assessment. Can we do that?
I don't really want to, but I need the help. Okay, ask your questions.
Well, actually, my screen just froze and I'm gonna have to reboot the computer. I'm so sorry. It'll just take a few minutes.
None of you have ever had a call like that, right? Okay, so while this was going on, I put out some sheets on your tables. There are 3 questions on the sheet. One is, what did the INA counselor do that helped facilitate the call? What did Jacqueline do that made the call more challenging? And what would you do and why? So at your tables, and if people are just in 1s or 2s at tables, if they would join the next table, I'd like you to discuss all 3 of those questions. Okay. So I'd like some volunteers, someone to speak for their group at the table, to tell us what they think. For example, what did Jacqueline do that helped facilitate the call? I know you want to tell me what she did wrong, but tell me first of all what she did well.
Well, I think Jacqueline did pretty well in keeping, remaining calm, not reacting to the caller's frustration. And that brings up another point. She acknowledged the caller's frustration, and I thought tapped into her feelings pretty well.
Okay. I think we have someone here.
I think there were some times when she really was focused on the caller, limited times, but sometimes. And there were times when she was, I think, more focused on having a more natural conversation with her.
Okay.
Sometimes.
All right. Anyone want to add any other praise for Jacqueline? Okay, so tell me what she did that made the call more challenging.
She was distracted, signing paperwork,
Wait. Gotta get you on the mic.
Sorry. She was distracted, like signing paperwork while she was on the phone, and then missed some of the information that she had asked her to share.
Okay.
So that was a little frustrating.
Yep. Lori, behind you, got a couple of hands.
No, I would say from the first exchange, she put the woman on the fence about challenging her about the 15 minutes, where she could have been a little apologetic and, really, steer the conversation a little bit differently rather than really getting into an antagonistic relationship to start off with.
Okay.
They kind of set the tone.
All right. I think there was a hand at the back of the room.
Well, I think she was focused more on collecting data than on the needs of the client, and she was referencing, let's open another screen, and it wasn't really meeting the needs of the client, I don't think.
Okay. Anyone else? All right, so the call has reached this point. What would you do next and why? Any thoughts?
I think for me that call was very unrealistic to what we typically do within a day and what we do. I think having her go so off course with what the client was originally even asking, and then constantly asking for more information but never giving detailed questions as to what that information would be, was just so vague, and I would hang up on the lady too. Like, that was terrible customer service. So I think if it gets to that point, then there's a full retraining needed to even engage people in what their needs are. But certainly from the very get-go, like the gentleman said, being able to identify what the person needs, de-escalating a situation if somebody is calling and is already upset, and then getting to what they truly need, and not kind of going off on all these other tangents where the call even got that far in the first place.
Okay. Anyone else? Okay. So this always feels like the moment where I should sort of say that Jacqueline did a lot of things that I asked her to do, that Jacqueline actually has really good skills, but we wanted to sort of illustrate some of the things that can happen when, as was said, we get too focused upon collecting information, getting the information into the system, and when we don't self-correct, and when we lose that opportunity to establish that personal relationship with the individual that we're seeking to reach out to. If you could advance the slides just a little. Okay, so it all really begins with good telephone communication technique, and this was really where we started when New York Connect started, was sort of thinking about what are the most effective ways that we can behave on the phone to really be able to reassure people, build relationships, gather the information. We operate, we operate a call center at my center, and we do a lot of calls from all across the state and all across the country. And sometimes when I'm walking through the call center, I'm always very struck by that there are two staff. They're all very good, but there are two staff in particular that are always smiling when they're on the phone. Always smiling when they're on the phone. And when I'm out and about and I'm doing visits around the state, or for that matter in other states, and people talk to me about our call center and they want to pay a compliment to someone that they had a really good interaction with, most of the time they highlight those two staff who talk with a smile in their voice. And so while it is our voice that is the most important thing when we're on the phone, there are behaviors that we can do that make us much more effective. But that said, as we think about sort of that it is our voice that's primarily that people are relying upon, that being kind, polite, direct, enthusiastic, speaking with a strong voice, that doesn't mean speaking loudly. It means speaking with a strong and a clear voice is really helpful. Trying to have little or no background noise. Being sort of building a relationship but not being too familiar, recognizing that people have different senses of whether it's okay, as we saw there, that whether or not you can use my first name or whether or not you need to call me Mrs. Jones. To be thinking about what's going on in the rest of the room and how do we exclude that. And so talking to other people in the room can actually be confusing for the person that's on the phone. Not eating, not drinking, not chewing gum when we're talking on the phone clearly influences the quality of the call as well. But I think, too, that if we are going to be entering information on computer screens, that we need to have them open. We need to be familiar with the screens. In the video that you saw, Jacqueline clearly wasn't familiar with, she kept saying, which screen is it? To have things open. But I think that it comes down to something much more fundamental as well. Again, sort of recognizing that we may have people who themselves may have some hearing impairments, who aren't used to our protocols, and making sure that we set people at ease from the very start. That when we answer the phone, we introduce ourselves, but people don't always hear what we said. And I've experienced this myself, just trying to sort of follow up and trying to get bills paid and things like that. And somebody answers, and it's not exactly what I thought. And I say, is this so-and-so? And they just say yes. and I'm not actually sure that they even hear me. And if I'm a little bit confused about what's going on, and particularly when I've been sort of transferred to 3 different people, I'm not even sure that I asked the right question. So, well, we are really important in that first moment in helping the person feel ready for the call. Same thing happens when we close calls. That, you know, if we're wearing a headset, all we do is click when we're done with the call. That's kind of abrupt, particularly for people who aren't operating with headsets themselves, and that for them, at the end of a call is you say goodbye and you put the phone down. So knowing that the call really has ended is becoming less clear anymore. For certainly, you know, as we think about people who are stressed, people who have needs, who are calling us, to be sure that we actually have answered all of their questions, and to ask that before we end the call. To be sure that we make clear to people that the call is ending and that it's not just a click. And one technique is to ensure that they end the call first, that we stay on the line till they are gone, rather than being the person that ends the call. When we transfer calls, that we are transferring, first of all, can we transfer to a person rather than to people getting a machine where they're going to get a menu of 6 things. If they're going to get the menu, tell them what number on the menu they should hit. To be sure that we are transferring people to the person who can actually answer their question, and to explain who it is that they're going to talk to before we transfer the call over. And then being sure that we've actually transferred the person to the individual to the person that we think. Being sure that we're understood. And again, sort of, it's not so much raising our voices as it is speaking distinctly at a moderate pace. Staying with the caller. Recognize that there are also things going on for the person, and maybe things may be going on in the background in their own room. Perhaps they're also thinking about some of the things that we have said. They may not always be paying full attention. So making sure that the person is hearing the critical information, or what we think is critical information that they should have. Using everyday language. You know, I always think about this, that you know, No Wrong Door very quickly will produce its own acronyms and its own language. Just as everything that we've done produces its own acronyms and its own language. As we get into assessments for people, we start using assessment language. I often sort of challenge people when they talk about mobilization. I was like, you mean, can I walk? Let's use words that people really understand, and again, sort of really try to avoid those abbreviations that are really meaningful for us, but may not be meaningful for the person. If a piece of information is really important, then it's probably worthwhile repeating it. If we're giving out names, if we're giving out, how about spelling those names out so that people really get that information? To check in with the person on their understanding of what has been said, and always to be encouraging people's questions. So, an interesting experience a few months ago. My staff at the center, and for that matter, my wife and son at home, were all telling me that they really thought my hearing was starting to go. You know, they were having to repeat things for me. I, of course, resisted the idea that this could really be going on, but finally, to be honest, I was noticing it myself. And so I decided, okay, let me go and I'll see an audiologist. And if I was going to do this, I was going to do it right. So I got the full spectrum thing done. I did all the different tests. And then she sat down with the audiologist, sat down with me with all the graphs. And she said to me, okay, she said, here's what's going on. She said, you used to have, she said, truly incredible hearing. She said, you had to make absolutely no effort to hear things. She said, in fact, she said, people must have been really mad at you because you could hear things that they thought you couldn't hear. And I sat there and I thought, yeah, actually that's true. And she said, so now your hearing is approaching normal levels. And she said, you have to try a little harder, just like the rest of us. And I was like, well, okay. And then I said, but you know what? No, I don't agree. I think that there's more than that going on. And she pulled up the graphs and she showed them to me and she said, okay, there are a couple of other things going on and you probably should come in annually from now on, because there is definitely some deterioration. There are some tones that you don't hear well at all. And I said, well, what kind of tones? And she said, it's the tones in women's voices. And I was like, you've got to be kidding. I'm going back to my wife. I'm going back to the people in my office. I know many of you know Lisa Ferretti. You know, can you imagine me saying to Lisa, okay, it's your fault. It's your voice that's the problem. It's not my hearing. You know, it's just not going to happen. But what struck me was that take that when sort of, she was very clear, this is about aging, and I do a lot of aging work. I should be comfortable with acknowledging that I am getting older as well, and these changes are happening, and I am. But when you combine that with what happens in aging, what happens in terms of the quality of the phone equipment that I might be using, what happens with whether or not I am actually listening or I'm processing something that you said to me already, that clearly I can and I will miss things that are said to me, and that is true for the people that each of you are working with day to day. So it really falls to us to be thinking about how can I be sure that the person heard the really important things that I've shared with them that are going to be helpful to them. And so it is all of these things that we need to do in order to ensure that people have gotten the message. So I think about this in terms of coming out of motivational interviewing. They also talk about what they call ORs, that there are a series of things that we can do as we manage those conversations, whether it's in person or on the phone, to be sure that we're getting the information and that we're understood. And I'd ask you to think back again when we did those introductions and we talked about the comfortableness of sharing personal information with a professional in particular, that part of our effective listening and our effective data gathering is to help people to feel comfortable with sharing things that perhaps they're not that interested in sharing or not sure that they want to share. So open-ended questions clearly are really helpful. Questions that start with when or how or what or who, because we get more information, we're able to ask more questions. If we ask why, we're that nosy professional. I don't know why you want that information. I'm not sure I'm going to give it to you. We need to help people develop a sense of safety, that you're not blaming, you're not judging. When Mrs. Jones called in and she said, I want to figure out how I can avoid losing my money to Medicaid, Jacqueline did not react to that. She didn't agree with it, but she didn't react to it because to have judged or to have blamed isn't the way to build the conversation and the way in which we can be helpful. Reflective listening, that idea of helping people to hear their own words and experience your understanding. And Mrs. Jones, for periods of time, particularly when she was talking about her husband, talked for an extended period, was not sure that Jacqueline was actually listening. And in fact, we know, because we could see, that she was actually signing a document. So she had every reason to be suspicious that the person was not listening. So people need reassurance that we really are listening, that we are understanding what they're saying. And when we are reassuring people, it's not just, did you factually hear what I said, but do you understand the importance of what I said? Do you understand the difficulty of what I'm experiencing? And so throughout a conversation, summarizing is a really important skill for helping people to see, yep, I'm grasping the picture, or perhaps I'm not. And so then the person gets to explain to us a little bit more. And there were a couple of times where Jacqueline was trying to move the conversation in a particular way, rather than just saying, let's move on, or let's go back to something that I'm interested in on the call. Let me summarize what you've said in a way in which we're both ready to move on to the next piece of information that's needed. So we continue to have this challenge, and we'll increasingly have this challenge of managing a conversation and completing data entry. We clearly need to be explaining to people that we will be entering data and why we're entering the data. And there's certainly consent issues that come up within that as well. It shouldn't be, as happened in the video, that the person here is clicking and they ask what's going on, and then you say, oh, yeah, by the way, I'm entering a lot of data. I'm entering a lot of what you're saying. Some of us can type at 70 words a minute and can keep a conversation going very effectively. Most of us can't. And most of us sort of have some difficulty in processing the conversation and getting the information entered. And when you think about it, you're entering what someone has just said, and you're listening to what they are now saying. So to be able to think about, okay, if I'm going to be collecting more data now than I used to, how do I change the way in which I conduct myself in the conversation so that I can keep things moving, but I can get the information that I need and I can enter things. Particularly as we are now, for example, with the no wrong door screen, perhaps tell the person, this is the kind of information that I'm going to be collecting, to tell them how long it's likely to take, to let people know where we are in the process. You tell me this is going to take 20 minutes, and after 5 minutes, it feels to me like we've been on for 15. I'm going to be really disappointed 5 minutes later when you tell me, no, we still have more to do. So the more we can communicate where we are, what we're doing, why we're doing it, the more comfortable people are going to feel in this process. So again, explaining that you're entering the data, sometimes we just have to say, can we just take a moment so that I can enter the information? But then think about what are the supportive phrases that you're going to use during that time. Thank you for your patience. I know this is taking longer than you may have thought. I want to be sure that I get your information entered correctly. And what will be important to people, once this is entered, we won't need to do this again, are all messages as we are entering data that are reassuring to people, explain what we're doing, and will likely result in people staying on the call. But we are moving to having a more standardized protocol for our calls. We probably should practice using the different screens so that we don't end up in the space that Jacqueline ended up in. To remember that there are no nonverbals, that we are reliant upon what we hear the person say, and they are reliant upon us. So who knows what the rescue look is? Okay, so you're walking down the hallway, you turn a corner, and there's that person that if you realized they were there, you probably wouldn't have gone that way because now you're going to be stuck for at least 20 minutes. Okay, and then another person comes by who knows what has happened and who knows that you're stuck and you really don't want to be stuck there, and you give them the rescue look. And so they say, you've got a call, you've got a meeting to go to so that you can then get away from this person that you're stuck with. Anybody ever experienced that? Yeah, so a number of heads are nodding. The thing I always think about that is the person you're being rescued from, they also know what the rescue look is. And we always act as if they don't. But it's an example of a really powerful nonverbal, that moment when you look at that other person pleadingly and they sort of rescue you. Well, we don't get those kinds of prompts when we're on the phone. We're reliant on our voices. And what we say is critical to the consumer, to the person that is called in. That's their reassurance that you really are interested, you understand, you want to help. And so things like open-ended questions, close listening, clarifying and asking for detail, summarizing to check for accuracy, they're all really critical skills because they say to the person, you're really interested, you really understand, you're actually taking down the information that you need to be able to help me. And so therefore, going back to those introductions that we did, I feel comfortable telling you more information because something good potentially can happen from that.